What is yoga therapy?
Yoga therapy is a modality that involves a therapeutic relationship between a therapist and a client. The therapist and the client work together to establish a set of goals that are mutually understood so that the therapeutic plan is in alignment with what matters to the client. There are some essential features that distinguish yoga therapy from yoga practice, and those include an assessment or intake in which the yoga therapist is able to get a very broad understanding of what's going on with the client on all kosha levels, as well as specific information about what's happening in their areas of greatest concern. Additionally, there is a plan of care that is decided upon between the yoga therapist and the client that establishes a course of action that they're going to work through together. And that plan of care changes over time as priorities shift and as things change with the client's experience. Yoga therapy also has some form of assessment or evaluation that assesses how things are changing over time so that the client and the yoga therapist both know whether progress is being made in the direction of intention of their care. Yoga therapy uses the tools of yoga and all of yoga's practices in service of those goals. So that includes asana, pranayama, mindfulness, meditation, relaxation practices, restorative poses, yoga philosophy. Anything from within the wheelhouse of yoga is applied in service of those goals. What yoga therapists don't do is diagnose or treat as a medical doctor would. Any assessment that we do is from the foundation of the Panchamaya kosha model. So we're looking for imbalances in the koshas and using the tools of yoga to help ameliorate those issues, to help someone manage what they're experiencing and affect change in the direction of their wishes.
Is all yoga therapeutic?
This is a great question. There are some things that people do that they call yoga that I would say are not at their heart truly yoga, because yoga means practicing ahimsa. Yoga must be practiced in a state of non-harming. And so if someone is doing a yoga practice that is harmful, then it's not a yoga practice. It's a set of postures that is harmful to the body and therefore not in alignment with yoga. Additionally, yoga is a state of union between mind and body. So if someone is using yoga postures in a way that they are not mindful, not attentive, not integrating the breath, then it's just a series of movements, or a form of exercise. And those can certainly be harmful and therefore not therapeutic. I would say that when yoga is practiced in such a way that it is safe and appropriate with proper guidance and right for that particular person, done with mindful awareness and attention and in alignment with yoga philosophy, then there are a myriad of therapeutic benefits that can be derived. Those benefits range across all of the koshas to include changes in the physical body, energy and breath, emotions, thoughts and mind states, spiritual changes. But when yoga is practiced, we can't necessarily predict where those benefits are going to arise. So if someone sticks with a yoga practice for a sufficient period of time, they are likely to experience some therapeutic benefits. And so you could say all yoga is therapeutic when it's actually yoga, which is different from yoga therapy, which is looking to affect very specific therapeutic changes.
What role do yoga philosophy and spirituality play in yoga therapy?
I would say that yoga philosophy is part of the toolbox of yoga therapy. So just as a surgeon has a variety of tools and they pull out the tools that are most appropriate for a particular person and a particular issue, yoga philosophy is one of the tools that we might harness in order to help move towards someone's goals in a therapeutic relationship. I also think that it's important to understand yoga philosophy as a foundation of yoga, and that yoga philosophy can be a set of practices in and of itself that can be infused in daily life and part of the therapeutic plan. Those may or may not be spiritual. So, the spirituality is one of the koshas, and we have all of them. And some people want to address an issue on one kosha level, and it could have ramifications on other levels. And some people are really interested in the spiritual aspects of yoga and are really looking to affect change in their spiritual lives. So, as is the case with all evidence-informed practice, be that yoga therapy or otherwise, we want to consider the patient or client's perspective and values in the choices that we're making. So that might be having a real strong focus on spiritual practice, and it might mean that spiritual changes just happen as a consequence of other practices that are being included.
As a yoga researcher, what do you wish more yoga teachers understood about yoga research?
Well, one, I wish more yoga teachers were research literate. And really, I wish more people were research literate, which means being able to read a research study and understand it, not just all of the terminology, but the strengths and weaknesses of a particular study, and therefore how it might inform the choices that we make. If a study is done that is small and not very rigorous, but there's a big headline associated with it, sometimes people just see the headline and think that that's sufficient evidence to make a change in the way that they practice yoga. But if you really understand the literature and are able to be literate about it, then you can make choices that are appropriate based on the strength of the evidence. So I wish more yoga teachers were research literate and also understood the limitations of their knowledge around research and were able to defer to yoga researchers or collaborate or communicate with yoga researchers about the current state of the evidence and how it can or should inform the way that we teach and practice yoga.
How does a yoga teacher become more research literate?
There is a movement toward continuing education in yoga therapy that I hope will include research literacy. And I also hope that yoga therapy training in the future requires research literacy as part of the training. But there are actually a lot of offerings out there that might be helpful. There's an organization called the Science Sutras that's helping to build research literacy. YogaMate is also a website that has a lot of research-related information. And the International Association of Yoga Therapists is distilling yoga research into summaries that can be better understood by the general public. The best way to become literate in anything is to read. That's how we become literate in our native language. That's how we become literate in a foreign language. The more research you read, and especially if when you read it and you don't understand something, you look for answers about how to understand it better, the more literate you'll get. You might also be able to attend journal clubs near you or to communicate with people who are more research literate in order to ask questions and get more information about what the research means.
How has yoga research changed and evolved over the years?
How has yoga research changed and evolved over the years? A lot. It's really gone through dramatic changes in recent decades. The early stages of yoga research were not very rigorous and therefore were suspect and were not held in much regard by the medical establishment. The early studies also were feasibility studies or small pilot studies just to test, is yoga even possible? Will people do it? Is it safe? And then we could look at, well, what are the effects of the yoga practice? And so we've gotten to a place where we've established that yoga is pretty safe, people are willing to do it, and there are a whole lot of health benefits associated with it when it's done in a safe and appropriate way. The next set of studies are to compare yoga to other practices and see, well, how does yoga compare to the standard of care, or how might yoga be combined with other practices in order to affect even greater change? And then further down the line are the nuances of what particular yoga practices can be used in what combination in order to affect the greatest change for a particular condition or a particular population.
Are there any recent yoga-related studies or findings that you found to be particularly interesting, promising, or compelling?
There was a great study that came out not too long ago by Rob Saper and his colleagues up in Boston that was a non-inferiority study. And that means that it was seeing whether yoga was at least as good as physical therapy for low back pain. So the study was not designed nor powered to figure out which of those modalities was better. It was looking to see whether or not they were comparable. And in fact, what they found is that they are comparable, that yoga therapy is as effective as physical therapy for low back pain. Low back pain is incredibly common and affects a lot of people. And so what the study showed is that yoga therapy can be another option, another modality that might be useful instead of physical therapy, in conjunction with physical therapy or following physical therapy, which was really important, and we need more studies that look at comparison between yoga therapy and other modalities.
As the founder of Yoga for Arthritis, what do you wish all yoga teachers knew and understood about arthritis?
The reason I founded Yoga for Arthritis was because there was so little understanding of arthritis among yoga teachers, and arthritis is so pervasive, it's so common. It affects most people if you live long enough. And the more people realize the health benefits of yoga, the more people of all kinds, including arthritic populations, older persons, are going to yoga classes. And so I really think every yoga teacher needs to understand at least a little bit about arthritis and how to keep people safe. The one thing that I wish yoga teachers were more sensitive to is that moving someone else's body into a particular position when you don't know what it feels like to live in that body can be painful and even harmful. And so being really gentle with assists and understanding regarding someone's limitations and not expecting someone with arthritis to be able to achieve a particular shape or suggesting that a particular shape is necessary or right is so critical for people with arthritis to feel safe, accepted, and comfortable in yoga classes.
What should yoga teachers and therapists consider when discussing the benefits of yoga?
There's a way that yoga professionals sometimes talk about yoga that sounds like a snake oil salesman, that we are promising that yoga is going to change absolutely everything, cure whatever ails you, and fix whatever might be happening in your life. And that's really suspicious. So it's important not to suggest that yoga is going to cure anything. And in fact, because we don't treat disease, we don't even think about yoga in those terms. But we can say that yoga can help people to live differently with their conditions, whatever they are. They may experience some improvements in their symptoms, but certainly the way that they feel about life with whatever those challenges are is likely to change. The more we can soften the language that we use about the promises we make regarding what particular benefits someone might expect to achieve from yoga practice, the better our modality will be received by other healthcare providers.
What is your number one piece of advice for helping students to stay safe and avoid injury during yoga practice?
I'm going to give two. So the first is see a medical professional, because you have to know what you're working with in order to keep safe. If you're having pain in a particular part of the body, you need to know what's causing that pain so that you know how to keep safe. So that's first and foremost, get all the information you can. And then two, listen to your own body. If something doesn't feel right, trust your sense that it's not right. Follow your own inner guide instead of listening to what someone else tells you you should or shouldn't do with your own body. Listen to the cues, be mindful and aware of your own bodily experience, and make adjustments in the direction of non-harming.